In this short video, we're going to look at the operation of the Saflo 90 device. This is available in 4 configurations. 2 of these are for direct use with a syringe driver or infusion pump and have a 100 centimeter connection tube. 2 models have a very short connection tube with a needle-free port attached to them. These can be used for intermittent injections into a patient or, by connection to an extension set, be used for fluid infusions for different clinical needs. Whichever type you use, they are both color-coded in the same way. With a blue cap, they have a 9mm catheter, and with a green cap, they have a 6mm catheter. These should be chosen as appropriate for your particular patient. Before you use the product, you should take note of the lot number, which is indicated on the label and also on the box in which the device is delivered. This is particularly important if a problem should occur and it's necessary for the manufacturer to investigate this. To use the device, open the packaging by removing the top label. Then remove the device carefully from within its container and it's ready for use. Before using the device, just note the features which are here. The tubing is 100 centimeters long and is used for connection to your syringe driver. There is a protector over the needle and there is a paper backing to the adhesive tape. The next step will be to prime the infusion set. You should note that the priming volume on these devices is very low at less than 0.2 of a mil. Priming should follow the instructions in the syringe driver's user manuals or any local instructions that are in place for this procedure. For the purposes of this demonstration, I will prime the infusion set manually using a syringe. Carefully advance the syringe until you see a small drop forming on the tip of the needle. Because of the very low volume required, this will occur very rapidly. Once the infusion set is primed, it can then be connected to the infusion pump or inserted to the patient, depending again on local procedures. Before insertion, it is important to ensure that the infusion site has been prepared according to local procedures. Once you are ready to insert the device, first of all, remove the paper covering by gently pulling away from the tape. Gently remove the protective covering over the needle. Insert the device into the patient, ensuring it is going in at a right angle to the patient's skin. Once in place, smooth the tape down to ensure it is secure. Hold the white plastic base of the device and twist the cap in an anti-clockwise direction. A click will be heard, which will indicate that the needle has been removed from the device and is now safe to continue. Release the white base and lift the Saflo away from the patient. You will notice that the needle is now fully secured within the cap. Place the soft flexible rubber cap over the top of the Saflo. This has no clinical function, it is merely a comfort device to prevent snagging on patients' clothing. Although the needle is now safely contained in the cap of the device, it is important to dispose of it in a clinical waste container according to your local procedures.